Hello and welcome everyone. I will be talking in this presentation about medical students' options after graduation. Congratulations that you graduated from the medical school. Now you are asking what are the career options available for me. So I will be laying out the options simply as clinical career type of option and non-clinical careers. The clinical careers has either medical side or surgical side. This is speaking in a broad term and generally. The non-clinical part where the doctor or the graduates will not have an opportunity for direct patient contact for management of his health issue. And this one has many options and will involve either studying for basic sciences such as biochemistry, anatomy, physiology, and please note that pathology is considered as a clinical part of the career, and in some countries it's considered as a basic science study. I will be speaking more about the details of the academia and the studies on the basic sciences when we reach there. There are also the researches and administrative and public health types of the career, as well as other type of options available in a non-clinical type of career. So moving ahead, the clinical career where it's medical, it includes internal medicine, and this one has many subspecialties: cardiology, gastroenterology, neurology. And specifically about neurology, it's now a separate and well-formed specialty. And there are also rheumatology and the other subspecialties such as dermatology, ophthalmology. It's also like the neurology is a separate specialty, and it starts with the training from different pathway than the internal medicine. However, they rotate through internal medicine, some of the internal medicine sections, in order for them to get prepared for the practice. There is also the family medicine and the primary care medicine. These are the family practitioners who's working in the outpatient clinic. However, in some countries, these physicians has options to do management at the ER, as well as in the inpatient and rotating over the patients admitted to the hospitals. There is also the pediatric medicine. It is very similar to the internal medicine. However, with the young adults and children with their own health conditions and their own subspecialties, such as the hemato-oncology, and there is also the psychiatry. Moving ahead to the surgery, there is the general surgery with many subspecialties: cardiac surgery, transplant surgery, and surgeries related to soft tissue, and surgeries related to gastrointestinal tract. And these are done through in the operation room with the surgical teams, which has anesthesiologist, and this is also a specialty of the related to the surgery. In some countries, it's related to the intensive care unit, and it's included with the intensive care unit to be intensive care unit and anesthesia. Other types of surgical careers includes neurosurgery, orthopedic, ENT surgery, and ophthalmology. Non-clinical types of the career has basic science academia, as we mentioned earlier. So in this type of non-clinical careers, the graduate usually goes for higher studies in the master's degree, and his main focus will be around the physiology of the body function. So the main function will be around the basic sciences academia pathway, and studying physiology, anatomy, and in a master's and PhD degree could take 2 to 3 years, and the doctor or the graduate will usually specialize in the academia and will be teaching in the universities. Some of the physicians actually tend to go for a non-clinical type of career with their careers to be physician scientist, and they conduct researches and make some clinical trials and experiment, and writing some review articles about clinical observations. And this is actually encouraged nowadays to have integrated practice and to integrate the researches with the practice of the physicians. Other types available for the physicians will be administrative and public health, and this will be the doctor will be specialized in providing services and assess the quality for the health services for the mass populations. And usually the doctor will study through college for obtaining this degree, and will have some knowledge about the statistics, and then he can have an administrative function in hospitals to be a manager of hospital or Ministry of Health. Others will be related to business related fields, medical type of professions, biotechnology, financial and medical insurance, where the graduates can work in insurance companies, medical insurance companies or life insurance companies, and some countries require the graduates to have a license in order for him to practice this. So this was a general review about the available options for a medical college graduate. And if you are not sure about which one to choose, you can please visit our website and go through in the description and go through a form and fill that inquiry form. We will get back to you with some guidance. Thank you very much for watching this presentation, and I wish you the best of luck in your career. Thank you very much.